Krieger. Maybe it's just because I'm a badass, but chemotherapy, it's kind of a breeze.
Yeah, that's my point. 2 weeks of chemo with no hair loss and you're not experiencing any nausea?
No, gracias a Dubi Medicinao, which I gotta tell you, huge fan.
Oh yeah?
Yeah, and I advocate its use. As a potential role model, I advocate it.
To combat chemotherapy-related nausea, or for cannabidiol's clinically proven ability to inhibit cancer cell growth.
It does that?
Yep.
Welcome back to this week's segment of Behind the Drug. Today we'll be covering Marinol. Here are some facts about Marinol. Marinol is tetrahydrocannabinol, or dronabinol. We'll be calling it THC. It was FDA approved on May 31st, 1985, for chemotherapy in AIDS patients struggling with appetite loss and nausea. A prescription is required, and Marinol is available at a retail price of $300 a bottle or $5 a pill. This is for a 2.5 mg dose. THC is naturally found in marijuana. However, marijuana is regulated in the US as a Schedule I drug. This makes it illegal to possess, distribute, or use at a federal level. So, if it's illegal, why are we so interested? THC, among other compounds found in marijuana, have shown to improve symptoms by decreasing the frequency of epileptic seizures and calming patients who suffer from autism and post-traumatic stress disorder. This is in addition to the antiemetic properties mentioned previously. This is the structure of THC. The starting products for this synthesis from the patent synthetic route to dronabinol are cis-menth-1-ene-3,8-diol and olivitol. This is taken in an organic solvent, catalytic Lewis acid, for 2 to 8 hours at 15 degrees Celsius. This forms a trans intermediate that undergoes cyclization into dronabinol. It is also important to note that the R group is related to the analgesic properties of THC. Not much research has been possible because of marijuana's Schedule I status. However, we do know that humans have endocannabinoid systems. Normally, synapses relay chemical messages or neurotransmitters to each other from the presynaptic neuron to the postsynaptic neuron. However, in the endocannabinoid system, cannabinoids are relayed backwards from the postsynaptic neuron to the presynaptic neuron. When cannabinoids reach their target presynaptic neuron, they can subsequently affect the amount of neurotransmitters released. Because the endocannabinoid system is extensive throughout the body, they can have effects on different areas and biological systems. Here's a better way to explain THC's effects on the body. Have you ever heard the saying, "When life gives you lemons"? Now, a person can do whatever they want with the lemon they've just been given. They can make lemonade, they can throw it at someone, they can plant it to make more lemons, or they can sell them to Dr. Wiseman. There's an infinite number of things to do with a lemon. Now imagine that the lemon represents THC and the person receiving the lemon represents a cannabinoid receptor, CB1 and CB2. The variety of things to do with the lemon corresponds to the variety of responses of the receptor to THC. However, there are a few limitations to this analogy. There's a finite number of CB1 and CB2 receptors, and the responses in the body, whereas you could do anything with a lemon. Like all drugs, Marinol has some adverse effects that are possible on the body. This includes mood changes, dizziness, drowsiness, confusion, trouble concentrating, feeling high, warmth or a tingly feeling, an exaggerated sense of well-being, anxiety, lightheadedness, headache, red eyes, dry mouth, nausea, vomiting, stomach or abdominal pain, diarrhea, sleep problems, clumsiness, lack of coordination, weakness, or unsteadiness. Since THC affects people differently, Marinol's effects on a patient can vary widely based on individual responses. There also needs to be more research done on the subject for anything to be said definitively. Here's more information if you're interested. Thank you for tuning into this week's segment of Behind the Drug. Make sure to subscribe and like our video.